Hello, Facebook friends. It's Carly, your online doctor, with today's Live in 5. Today is Monday, October 28th. It is 5:05 p.m. Okay, so I was asked by a friend to discuss a very important topic. It's called Polycystic ovarian syndrome, or PCOS in its abbreviation. Okay, this silent disorder is one of the most common hormone disorders in women and the leading cause of infertility. Let that sink in. It affects anywhere from 6 to 21% of women of childbearing age. It is also associated with an increased risk of developing type 2 diabetes, mood disorders, endometrial cancer, fatty liver, sleep apnea, hypertension, metabolic syndrome, and cardiovascular disease. Okay, so this is a pretty important topic to be talking about. So PCOS can develop for a number of reasons, but it is generally accepted that insulin resistance plays an intrinsic role in its development. Signs and symptoms vary, but often include abnormal, if you want to call it abnormal, egg development. Okay, so after an egg normally is released, the sac around it is around the egg goes away. Okay, it disappears after your cycle. In women with PCOS, however, it doesn't go away, and instead it fills with fluid, and this happens month after month after month, creating multiple cysts of fluid in the ovaries, thus the name polycystic ovarian syndrome. Okay, it's an appearance by ultrasound, and obviously in reality, if you were to look at the ovary directly, that looks like a little sac, multiple little sacs of fluid. Okay, these women often have in their ovaries, they produce slightly more male hormones, androgens, than normal, which can result in facial hair or even male pattern baldness, as well as acne and mood disorders, because women are not supposed to have higher levels of androgens in their body. So it creates that hormone imbalance, right? So other symptoms of PCOS include menstrual cycle irregularities, understandably, weight gain, fatigue, and even low libido. The cause of polycystic ovarian syndrome is not really known, but some of the theories include, as I mentioned, insulin resistance. They say it does run in families, so there can be a family history of PCOS, smoking, excessive alcohol use, metabolic syndrome, elevated androgens, and quite a few others. And it's interesting because some of the causes are actually the symptoms. So which came first? Like, does the high elevated androgens cause it, or is it a result of the condition? If you understand where I'm going with that. Okay, so there's really no one size fits all answer when it comes to why women get PCOS. How is PCOS diagnosed? Multiple criteria actually exist which require different combinations of the following to make a positive diagnosis. Okay, number one, androgen excess. Okay, we talked about that, including testosterone, DHEA, and a few other male hormones that they may be subclinical, even on blood testing, but overall the trend is that they're elevated. Number two, ovulatory dysfunction. Irregular periods, missing periods, abnormally heavy, short or long cycles, any type of combination of irregularity in the ovulatory cycle would qualify for that one. And three, polycystic ovaries on ultrasound. Okay, clearly if you don't have polycystic ovaries but you have the other two, it's either too early to detect them or you don't have it, right? So the criteria that is used is called the Rotterdam criteria. It requires any two of the three, but some feel this leads to overdiagnosis. So if you really don't even have polycystic ovaries on ultrasound, it doesn't quite fit the pattern. They may be followed to see if they're going to develop. But again, this is a syndrome. It's a group of conditions that require that can be treated the same way if you want to think about it that way. Okay, so currently there is no cure for PCOS, but that doesn't mean there aren't things that can be done. So let's continue talking about this tomorrow, because I think it's really important. I want to talk about conventional treatment options, natural treatment options, things you can consider if you have PCOS. If you have a friend or family member who has it or thinks they have it, tag them in this video so that they can watch it, and let them know to watch tomorrow, and I think Wednesday as well. I think I go into Wednesday as well. So 2 more days of talking about this, because I really think it's important to get the word out so that women can be empowered to help with themselves and to learn what their options are. So on that note, I hope you guys are having an awesome Monday. I'll be back again tomorrow for another Live in 5.